Hi, my name is Andrew Baird, and this assignment is in partial fulfillment of Nursing Policy N5382 at the University of Texas, Arlington. Good morning.
Hi.
Thanks for taking the time out of your busy day to meet with me.
Sure, my pleasure.
I just wanted to take a few minutes to discuss our institution's policy and the need to advocate for U.S. Senate Bill, Telehealth Bill 304, which actually increases reimbursement rates for telehealth services for patients diagnosed with chronic illness. Given the complexity of liver transplant patients, it's been proven in other hospitals, telehealth services can actually reduce 30-day readmission rates. The national 30-day readmission rate for transplant patients is in excess of 40%, accounting for 10% of the direct healthcare costs. Hospital Medicare penalties associated with readmissions is in upwards of $528 million. To further compound this statistic, 2,597 hospitals across the U.S. do not meet Medicare readmission standards. Our readmission rate for liver transplants within our own institution for transplant patients is 46% at last calculation. Many of these readmissions could have potentially been prevented if the condition that they were readmitted for was actually caught sooner by closer monitoring by their transplant coordinator or their doctor using such innovative technologies as telehealth. Is an institution who performs in upwards of 175 transplants yearly. This technology could have significant impact on our fiscal burden in addition to improving the care of patients that we provide care for. This bill introduced to the 155th Senate proposes increasing Medicare reimbursement rates to organizations using telehealth care of patients with a chronic disease process, and in our case, the liver transplant patients. Goals for the organization would be to achieve a reduction in readmission rate, 30-day readmission rates, improve care outcomes through quicker access to care within the home for the patients, and overall decrease the cost for both services provided by both nurses and doctors, and actually possibly even rather than patients having to follow up in the clinic, for stable patients, they can actually receive these visits in their home, which actually has a cost savings associated with it. Monitoring medication compliance, and also providing education to both the patient and the caregiver within their home. Through using telehealth programs which can connect with the patient's computer or smartphone, this provides them easy access to get in touch with their transplant coordinator for follow-up appointments. It could be conducted much easier without long-distance drives, which many of our patients actually have to go through with. Stakeholders include nurses and doctors charged with caring for this vulnerable patient population. Lastly, it is crucial that we, as the third largest transplant center in the U.S., advocate for this change in Medicare funding and reimbursement that this bill proposes. Thanks for meeting with me today.
Sure.